Bismillah, alhamdulillah, wassalatu wassalamu ala Rasulullah. Today we are talking about another topic known as hepatitis A. So usually there are five, six viruses which cause hepatitis. One of them is A, hepatitis A, then hepatitis B, hepatitis C, hepatitis D, hepatitis E. So they are mentioned that way because they solely and usually cause only problem in the liver. So today we want to talk about hepatitis A. So hepatitis A, what it does is that it enters into the liver and start causing damages to the cell, which can decrease the functioning of the liver. At the same time, it cause some symptoms, and then it can cause the compromisation of the health. So now we want to know that how does this disease spread? So hepatitis A is usually excreted in the feces, and it can contaminate the waters, and people have low hygiene of the body, and it can be transmitted through that into the mouth, and it can cause like infection of the intestines, and it can lead to the infection of the liver, which causes secondary symptoms. So now question is that what kind of symptoms you may have. So one of them is fever, then there can be fatigue, and there could be low appetite. People can have vomiting and other things. So it's like spreads the same way as the typhoid is spread. It's healed very quickly in most of the people, like week or so, but there can be a dangerous infection where it causes fulminant hepatitis. So what happens in that there is a massive necrosis of the cells, and the liver stops working, or it doesn't keep the pace of its function. So what should be the signs and symptoms? Really, it causes jaundice. It can cause clay-colored feces. It can cause the darker urine, and there are other signs and symptoms which are present in this disease. So, what is the treatment for hepatitis A? There's no treatment for hepatitis A, but we can support the patient with certain things that try to solve the symptoms and signs. First of all, if patient is vomiting, we can give anti-vomiting medications. Similarly, there are some chemicals given like Siliver and Hepamers, and its efficacy is questionable. So if patient has fever, we give Panadol, and like so. So if patient is dehydrated, we'll try to give hydration or make his hydration better. So the most relevant in hepatitis A is that majority of people get cured, but rarely it can cause fulminant hepatitis, where many functions of the body which are compromised. Like people can have prolonged PTAPT. They are not able to produce enough glucose. They are not able to store certain stuff. They are not able to metabolize certain things. So it can compromise multiple ways, and we have to admit the patient and try to make sure that everything goes smooth, and we have to manage inside the hospital. So the question is that how we can prevent this virus again. That we have to clean our water, we have to clean our hands, should have fresh and clean vegetables and fruits. So majority of the infectious diseases in Pakistan and other developing countries happen through water, so they are waterborne. So we have to make sure that it doesn't contaminate our clean drinking water, and our food should be clean. And one other very important aspect is that we should vaccinate all the individuals in Pakistan and even the countries which are developing. So that is the best thing to do. And hopefully our cleanliness and proper care can give better results. Thank you very much.